Assessing female genitourinary system.
Good day, ma'am. I'm going to perform assessing the female genitourinary system. Definition is, it is the process of examining the female genitourinary organs and includes inspecting and palpating of the organs. The purpose of this is to detect abnormalities that may range from life-threatening diseases to painful conditions that interfere with normal functions. The equipments are clean gloves, a drape, supplemental lighting if needed. Consideration before, during, and after the procedure. Identify client and explain procedure. Provide privacy. Make sure client is comfortable throughout the procedure. Document findings. Things to document after the procedure. Observations. Findings either normal or abnormal. The first action is introduce self and verify the client's identity. Explain the procedure to the client and of course provide privacy. Good day, ma'am. I am Nurse Rahma Naim. I am going to assess your female genitourinary system. Is that okay po ba, ma'am? This is to gain cooperation and lessen the anxiety of the client. Second is ask the client to empty her bladder before the examination begins. Ma'am, nakaihi po ba kayo? This is to provide client's comfort. Next is perform hand hygiene, apply gloves, and observe appropriate infection control. This is to minimize contamination. Ask the client to remove her underwear, place her in a lithotomy position, and drape. This is to provide good visualization of the female genital. Next is do perineal care. This is to minimize contamination. Next is inspect the distribution, amount, and characteristics of pubic hair. Normal findings, wide variations, generally kinky in the menstruating adult, thinner and straighter after menopause, distributed in the shape of an inverse triangle. For the abnormal findings, scant pubic hair, which may indicate hormonal problem. Hair growth should not extend over the abdomen. Next is inspect the skin of the pubic area for any presence of parasites, inflammation, swelling, or lesions. Normal findings, pubic skin intact, no lesions, skin of vulva area slightly darker than the rest of the body, labia round, full and relatively symmetric in adult females. And for the abnormal findings, lice, lesions, scars, fissures, swelling, erythema, excoriations, varicosities, or leukoplakia. Next, with your thumb and index finger, separate the labia and inspect the clitoris, urethral orifice, and vaginal orifice. Note position, color, size, and presence of drainage or lesions. Normal findings, clitoris does not exceed 1 cm in width and 2 cm in length. Urethral orifice appears as a small slit and it's the same color as surrounding tissues. No inflammation, swelling, or discharge. For the abnormal findings, presence of lesions, presence of inflammation, swelling, or discharge. Next, palpate the inguinal lymph nodes in the groin area and the vertical chain at the inner aspect of the thigh, not for any enlargement or tenderness. Normal findings, no enlargement or tenderness. And for the abnormal findings, enlargement and tenderness. Lastly, document findings in the client record using forms or checklist supplemented by narrative notes when appropriate. This is for record of data.